we are going to talk to you about learning to cope in uncertain times. Hi, and welcome to Urban Counseling Clicks podcast. I am Dr. April Givens, and my guest today is Dr. Nakia Hamlet. Welcome, Dr. Nakia.
Hey, Dr. April, thank you for having me. I'm glad to be here.
Yes, I'm glad that you are here. Introduce yourself to the people. Tell them a little bit about yourself.
Hello, my name is Nakia. I am a clinical psychologist and I'm the founder and CEO of two companies. One, Hamlet Psychological Services, which is a traditional psych testing and consultation company, and Complex Psychology, which is a workshop and hybrid course company. We specialize in digital courses and wellness and mental health topics and diversity, equity, and inclusion. So I work with companies and individuals towards wellness for all of us.
Okay, sounds amazing. So
Thank
today
you.
we wanted to meet so we can just discuss, just some things that are happening. A lot of things are happening in the world right now, and we want to be able to provide people with just some coping skills and some resources to be able to get some help. Because I know everyone is kind of feeling the pressure when you watch the news and so many things such as mass shootings and the trafficking and just so much going on. So we want to come and try to be a beacon of light and offer some encouragement and some help to move forward.
Absolutely. Absolutely.
Okay. So we are going to start with, what do you want to start with, Dr. Nakia?
Well, I mean, maybe just a moment of reflection on how many things are coming at us right now in the world. It's hard to process. We can barely get through one thing before the next thing. So I think just a second to think like, man, we are dealing with a lot of things.
Yes, we are. And I think a lot of people are really, suffering from anxiety, stress, overwhelm, just not really knowing which way to turn. So, and wondering like, what do I do in this situation? And I want to encourage people to seek counseling, to use your resources. If you are working, your employer 9 times out of 10 have something called EAP,
Hmm.
Employee Assistance Program, where they will cover you 3 to 5, sometimes 12, 8 sessions of counseling. Utilize that. Call your EAP department and set up counseling services and get with a provider so you can be able to learn some coping skills and de-stress and talk about some things that you are experiencing in your everyday life.
Absolutely. And I think we're at the point where I hope most people or everyone knows that we all need help from somebody at some point, and it doesn't mean you're weak. It doesn't mean like you're failing at something. If you really just need that support of a therapist or a coach, supportive friends, family. I mean, this is the time to really kind of have all those resources in place and just use those areas to support your wellness.
Yeah, I agree. And I want to walk people through, I guess, what it looks like. Because a lot of people don't seek counseling because they don't necessarily know like what to expect. You're
Good
nervous.
point.
So counseling number one with a professional is not like talking to your girlfriend. If you go to a therapist and you feel like you're talking to one of your friends, you may need to find another therapist because you should be working on tools and different things to help you be able to live a productive life. So, generally, when you come to an initial counseling session, there's an intake process. Some therapists send you information, of course, paperwork to fill out, which may include an intake with questions before you meet with them for the first time. Then when you
Hmm.
meet with them for the first time, you're going over that information. You're talking about maybe some of the things you listed that you wanted to deal with or wanted to focus on in therapy. You want to come to therapy with a goal. You know, a lot of
Hmm.
people come to therapy and they just come and they sit there like, okay, I'm here. Like you're
Yep.
about to teach them a class or something. And it doesn't necessarily work like that. You have to come with a goal. You have to come with a specific, maybe, problem or something that you want to work on. So you come to the therapist with that, and then you start to map out a plan with the therapist on how you're going to achieve that goal or find a solution to that issue. And then you start to unpack things. And that therapist generally uses some type of modality. They may use cognitive behavioral therapy. Some therapists are trained in EMDR,
Hmm.
hypnotherapy, solution focused therapy. So, all of these are different theories that we pull from in our training to be able to talk about whatever specific problem that it is that you're having. And maybe that theory works best for that particular problem. For an example, like DBT, dialectical behavioral therapy, works best for people who may suffer from borderline personality disorder. So that's the modality and the theories and the training and the different exercises that that therapist would use to work with you if that's something that you're dealing with.
Totally agree. You know, and I would add that, sometimes it's subtle, right? Like we always kind of think we're mostly all resilient, right? So we go through a lot, we deal with a lot of stresses. And I think sometimes people don't recognize when they're not feeling like themselves or they're at that point where they really could use some help. So, in terms of the goals, I mean, even if you just think like, I don't feel like myself, I don't have energy, I don't want to, do things I used to love to do, I can't get out of bed, or I find that, I'm too more irritable, or I, feel sad, or I'm worried all the time. I mean, you can kind of just reflect on how you're feeling, and then it helps you kind of think about a goal. Even if some people say like, I don't really know what I want to work on, but just imagine if you're not feeling like yourself and it just feels like things are harder than they should be. I mean, that's a good time to maybe think about talking to somebody.
Right. Absolutely. And I think that's great, Dr. Nakia. You made a good point on just some people do come and they don't really know. Like, I don't really know where to start. Or they have multiple things that
Yeah,
they have
that's
going
true
on.
too.
And it's okay to have multiple things, but you want to be able to work on one thing at a time.
That's right.
So maybe writing down all of those things that you're struggling with. And then when you come to therapy, it's like, these are all the things that I'm struggling with. But my priority right now is to work on this. So we'll do this first. And then maybe in the next session, you can tackle the other thing. And then the next session, you can tackle the other thing. So you can get all of your needs met, but it needs to be broken down so you can at least find a solution to the one that's most triggering first.
And don't you find, Dr. April, that like if you can take that one thing that, like you just said, is the most triggering, that causes the most problems, if that starts to get better, I think
Hmm.
sometimes people find that other things also start to get better, or at least they don't seem as difficult. Because you
Right,
get coping
absolutely.
strategies that then you can use outside of therapy.
Yeah, and you can use with some of those other things that you're dealing with as well. But the thing about it is, it starts with you, and you have to be able and willing and wanting to do the work. You know, no one else can't want it for you. You can't come to therapy because, oh, my mom says I need to come, or my wife says I need to come, or my husband saying I really need to fix these issues. What do you feel like you need to fix? Because
Yeah,
that could be those other people's problems, and you may
that's
not
true.
necessarily have anything that's really wrong. It's just an issue that they're finding. And so generally it may be their issue and they need to be the ones coming to therapy.
That is true. You do have to distinguish that, right? And I mean, that's when it gets so tricky because sometimes, frankly, it's learning coping strategies to deal with the people in your life who are not ever going to go to therapy and cause you stress.
Right. Absolutely. But a lot of times those people want to point the finger at you, like you're the
Sure.
problem, and they
Right.
don't look at how they're contributing to it as well.
Absolutely. Absolutely. We live in relationships with people and it's not always easy. especially nowadays.
Yeah, I think it's important to just meet people where they are. Meet people where they are, and definitely have being able to have effective communication with one another. And that's important. That's what tends to, lead to long lasting partnerships. Both parties have to be willing to communicate with each other. It can't be one sided. One party wants to talk and then the other doesn't. That's not going to work. Everyone
Mm-mm.
involved have to be willing to communicate with the other person.
Absolutely. Absolutely. And, therapy can help with that practice, right? Like learning strategies and, practicing with your therapist, as you said, setting a goal. And then your therapist is kind of there to support your development towards that goal, progress towards that goal. And you can practice those skills with the therapist.
Right. Absolutely. So let's switch gears for a little bit. Tell me
Okay.
about some things that you're currently working on, Dr. Nakia.
Well, I mean, it probably isn't a surprise that most of us are thinking about diversity, equity, and inclusion. And so that's kind of the thing I've been focused on. Like, how do we help companies create psychologically safe spaces for people? I mean, when you see things like the mass shootings in Buffalo and Uvalde, and then you go to work, I mean, it's not like you can just forget those things and not experience microaggressions or whatever at work, you know, in a
Right.
different way. I mean, it comes with you. So how do we support organizations uh, creating spaces where people can bring their whole selves to work and feel safe? And how do we help? How do in my company I help individuals as well think about like how do I support my own wellness and how do I create safe spaces where I can fill my cup back up if my work is stressful or I'm struggling in another area. So I think a lot about equity these days, and I don't know, things seem like they're more intense than ever. So I don't know,
Okay.
it's hard.
Well, how do you get that information out to companies or find companies that are willing to, sign on to something
Yeah,
like?
yeah, so I do webinars, so I will sometimes have free webinars where companies can come and we just talk about skills around effective communication and creating safe spaces, you know diversity, equity, and inclusion strategy. Like, what do you need to do at that outset to really kind of start to really transform an organization into a safe space? So webinars sometimes. I go to conferences or I present at conferences, and I've created a series of hybrid um, workshops and courses. And so I have all these micro courses that basically we can kind of tailor for a company and for individuals that they can do learning on their own and then come together in groups for experiential activities.
Okay.
LinkedIn is mostly where I interact with companies and DEI professionals, and I just have conversations with people as a
Okay.
start.
So I think that's good. It's important to facilitate the conversation. And so I think it's important for companies to be able to offer something to their employees because, most people go to work. And so if you're working for, a large corporate organization,
Mhm.
they should have some things in place there to where their employees can utilize on how to feel better. What are some things that you can, do? And having some licensed professionals, people who are credentialed and trained, being able to teach them and that they have access to. I guess segueing into that, I'm actually on the Mental Happy app. And so we are,
Oh,
yeah, we're now focusing
cool.
on incorporating more companies and getting companies to actually get purchase subscriptions to the
Great.
app and be able to put their employees into the anxiety and stress management group so they can
Excellent.
learn coping skills and just have that immediate access to a professional where you can chime in, you can ask questions anonymously, you can, whatever, get all the information that you need. You can also attend, live Zoom events and to be able to ask questions. So I think that's important, that a resource is like that is available for people when they need it.
Right. And to your point, I'm reminded what you said earlier, that people have to be ready to do the work, right? Like, so
Mhm.
that resource sounds wonderful, but people have to kind of, decide maybe they're sick and tired of being sick and tired
Oh yeah.
and really commit themselves. And like you said, having a goal, like I'm going to do, these workshops on mental happy for the next 2 months or a month, a week,
Right.
because I find a lot of time the resources, there's so many resources these
There
days, but
are.
people don't always use them.
You're right. There are tons of resources, but a lot of times people go to the wrong places.
That's true.
Seeking these resources and they get upset or maybe turned off of therapy because whatever you went to wasn't a safe place for you.
Good point.
And so that's why, I like to encourage people to seek out people that are professionals that have training,
Hmm.
in this field. I know it's a lot of people are jumping on the bandwagon since the pandemic or being mental health advocates and life coaches and
Hmm.
doing these different things, celebrity backed, all of that, and not necessarily have the adequate training to be able to really help someone work through some deep rooted issues.
That's true. That's true. And so, asking mental health professionals like Dr. April, like myself, we can help people really find the resources that we already know from our experience are really, really worth the time and actually effective.
Right. Yeah. Seek the help from the appropriate people. I always talk about seeking help from also, providers that are medical doctors that specialize in whatever it is that you are experiencing. If you have been diagnosed with cancer, you would typically go see an oncologist.
That's
you
right.
know Kids go to pediatricians.
That's
So
right.
if you are having issues with mental health, first you may need to seek a psychiatrist and get an
Yep.
evaluation done. Then you will go to a therapist. Don't go to your primary care family doctor asking for anxiety medications or medications for depression. Go to someone who specializes in this. Seek a psychiatrist first. That's important as well because that can make or
Definitely.
break your diagnosis or misdiagnosis.
Definitely. And like we said, the resources are there, and there are people who really, really are there to help. And so I think it's a hard time right now in the world, but it's also the perfect time because we're so connected with our resources online and in our communities. So if all else fails, go to Google and just start looking for professionals in your community or online spaces that where experts can really guide you.
Right, absolutely. And before we go, another great resource is, your insurance. If you do have
Good
insurance,
point.
contact the number on the back of your insurance card, member
Great point.
services. They will give you a list of providers in your area within a 10-mile, 20-mile radius that
That's right.
accepts their plan, the exact plan that you are paying into. Call them so they can give you that information. I know a lot of people say, well, my insurance, I can't find this, I can't find that. Did you call the member services? They have a list of people that accept their plans. So they are the best one to be able to tell you, who you can go see that's in network with them.
Excellent point. So true. That's an excellent place to start. There's lots of companies that have very great wellness services as part of your benefits of working there. And so that's an excellent place for people to start.
Right. Absolutely. Well, thank you, Dr. Nakia, so much for being here. Is it anything that you want to
Thank you.
conclude with?
No, I just wish everyone well. Be easy with yourself in these really challenging times. Turn off the news sometimes, and just give yourself that space to rest and recover, and definitely seek out help. It can really, really make all the difference. So I
All
wish people
right.
the best.
Yes, me as well. So everyone, tune in to Urban Counseling. Click wherever you're viewing me on Twitter, Facebook, or YouTube, and just check out some resources for mental health.
Thank you, Dr. April, for having me here today.
Thank you for being a part.
Thank you.
Bye.
Bye.